Welcome everyone to another wonderful episode here at Jaws Podiatry. We have a very pleasant patient who has presented today with several chief complaints. Let's look at the right foot first. In respect to the right foot, the patient underwent a previous surgery. And the patient, I'm going to give everyone a better view here, the patient has essentially a golf ball in the toe. Everyone can see here, this is all bone. This is all bone. So this is definitely, affecting the patient's daily life activities. It's extremely painful. Again, the original procedure was intended to fix that. For whatever reason, she still has the problem. So the idea is to perform a chylectomy procedure. I'm going to show, possibly show the x-rays so everyone really understands how the bone has adapted in the joint itself. It's pretty striking. In addition, also, the patient is sort of not happy with the deviation, the transverse deviation this way, right, medially. Also the patient, this toe is a little bit longer than all the others. The patient did move a little bit, but the parabola, when we look at the parabola, right, and when we talk about toe shortening, this is what we were discussing today here, to be able to maybe shorten the toe a little bit, to have it come, give it a more natural look. Right, we follow, just like I've told you, the whole world before, we follow the parabola, which is extremely important. Let's take a look at the left. To a lesser extent, the patient did not have surgery here before. Patient has the same clinical presentation, hallux limitus, hallux rigidus, more so like a limitus and a rigidus, and the same thing goes for the second toe, which is basically a little bit longer than the third. You can really appreciate when you look at the third, more so than this one, but if we were to shorten it maybe a couple of millimeters, it would look really, really nice, just because the parabola would be quote unquote more anatomically sound, so to speak. So that's exactly this is what the patient has presented to our office today with. Again, just a quick recap. Patient does have a golf ball here, hallux limitus rigidus. Make a tiny little incision here, another one here. We would definitely shave everything down. Very, very important. We don't want to shorten the toe or do anything that would shorten, because then all of a sudden, just like the patient and I were discussing, then that would give the appearance, of course, of the second toe being out to here, and we don't want that. Again, just a quick recap. This is Morton's toe. When we looked at the x-rays, there are 3 bones in the toe, and the middle phalanx, the one in the middle, is extremely long. So, that's something that we do. As everyone knows, we do a lot of toe shortening procedures here. I think the patient's going to be very happy with everything that we have discussed today. So, like always, www.jawspodiatry.com, Instagram, Dr. Toe Jam, Jaws Podiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. Like always, if anyone has any questions, please feel free to reach out to us on any of our social media platforms. Have a wonderful day, everyone.